Hey folks, Cesar Perez here. I'm going to be talking to you guys about the executive order that the president signed yesterday regarding healthcare price transparency. Now, I'm going to be analyzing what the possible impacts are going to be for the future. Obviously, in my case, I talk to a lot of doctors, I talk to a lot of office managers, and so I'm in the industry. I help people with health insurance, and I talk to doctors' offices, and they all share their perspectives with me. And so I think I have a pretty rounded, well-rounded picture of how everything pretty much works. And so I'm going to try to share that with you in my analysis of this. Essentially, there are 5 main points that the executive order goes into. The first point is they require hospitals to disclose information about their negotiated rates in formats that are understandable and usable by patients. Now, one of the things here is language that it uses. I'm pretty sure that a lot of hospitals, a lot of providers are going to be dragging their feet on this. I don't know if there's a specific timeline for this, but the fact that prices are not transparent is not a positive thing for the consumer, because you can't really get a price for the life of you. You can go to the hospital, they're never going to give you a price. They're going to say it depends. And so it's if they have to have this available, especially if it's going to be available online, everybody's going to have the ability to see what the negotiated rates are for every single carrier or every single plan. The thing is, right now, hospitals started putting their rates online, because I believe there was another executive order signed some months ago, and that requires hospitals to start putting up a price list. However, the reason I emphasize where it says a format that's understandable and usable by patients is because that format, that it's pretty much a joke. They give you codes and you do not know what in the world they're charging for. And so I looked at some of these prices that some hospitals had posted in our local area, and it really didn't make any sense. Like, I couldn't figure it out, and I'm in the healthcare industry. I help people with insurance, and the only ones that would possibly understand those terms or those procedures would be either doctors or billers. Most likely the billers, not even the doctors would probably understand that. But if they start implementing this where it's usable by patients, for example, in Oklahoma there's a surgery center where they give you a price if you're going to have, for example, hernia surgery, and it includes everything that's going to be done, anesthesia, everything pretty much. They'll list the prices, exactly how much it's going to cost. So hopefully some hospitals are going to be doing that. I'm sure that there's going to be a lot that are going to drag their feet and are not going to be compliant. But that's point number 1, and at least it's a step in the right direction when it comes to cutting down costs, because the more people are able to see who charges what, the more likely it is that will fuel competition between hospitals or even the providers. Second point, it says require insurance companies to provide patients with information about cost of care, including out-of-pocket costs, before they receive services. So another huge problem is try finding out how much you're going to pay for a procedure beforehand. It is almost impossible to figure out how much exactly you are going to pay, because they are going to tell you, well, it depends on this. It always depends, right? But there are some carriers and some insurance companies, especially when you're working for when you have a group plan through an employer, they have on their website, they do have like a price estimator tool, and hopefully that is available to anybody. When you have insurance, it would be awesome, it'd be nice if you could figure out, hey, this is how much I'm supposed to pay and not a penny more. That would be perfect. We don't have that now, and so that really does make it very difficult to, number 1, shop around for insurance, and especially because you do not know the negotiated rates of each insurance company or carrier. The other point is develop a comprehensive roadmap for consistent, limited, consumer-centric quality measures. So when they talk about developing a comprehensive roadmap for consistent, consumer-centric quality measures, that just means that's going to cut back on the paperwork that the doctors are going to be doing. For example, right now, a lot of the doctors I talk to, they spend so much time on paperwork, it's ridiculous. So if you've ever been to a doctor and they're just writing stuff down and they're not even looking at you, that's because number one, they have to spend more time doing paperwork than actually looking at you and treating you. Because there's number one, redundant paperwork to be done, or redundant questions, and so the administration started cutting back on those, and they're looking at different questions, paperwork that might be redundant, to eliminate it. So that's going to be a big plus, because not all doctors are probably going to do this, but the doctors that actually care are going to start spending more time with people after they cut back some of that paperwork, because they don't have to spend so much time doing paperwork for each patient. They can actually sit down and have a conversation and find out what's wrong. So if the doctor has more time, that's going to, number one, improve healthcare. Number two, it'll probably cut the costs as well, because you're saving time, and as we know, time is money. So the less time needed, the less office staff needed, the lower the costs. And so there's going to be doctors obviously that are going to try to cram more patients in, but the good ones are going to really stand out because they're actually going to take the time to be face to face with their patients and dedicate some of that time that they save doing paperwork to their patients. The other thing is doctor suicide is one of the highest it has ever been, and it's partly due to the fact that they're not really spending time with their patients. They're mostly just trying to peddle paperwork and trying to meet the requirements that the government sets up for them, which sometimes that's not in the best interest of the patient, because the doctor can't have a conversation and they can't sit down to figure out what's wrong. So that is something I come across quite often, and I hear that from a lot of physicians. The next point is, the fourth point is, disclose the identified federal healthcare data that protects patient and consumer privacy and enables transformation of the healthcare marketplace, and allows researchers to develop tools and analytics to allow patients to be at the center of their healthcare. So protecting consumer privacy. So we already have a law that's called HIPAA that pretty much protects the patient privacy. I don't understand from this language exactly how that's going to affect HIPAA. It's not very specific, but if they're trying to develop tools to allow more patient-centered healthcare, I mean, in theory that sounds like a good thing. We'll see if we get any more details on that, and then I can comment on that later. But at least their head is in the right place. I know that this bill, they had input from many different sources, including many doctors, the National Association of Health Underwriters, which is the people in the insurance industry such as myself. And so because we hear so many stories, you know, when they sit down, when the association sits down with the congressman or whoever is asking them for input, we have a pretty good perspective of the whole healthcare landscape. The last point is expand the availability of HSAs to cover direct primary care arrangements and healthcare sharing ministries, including more preventive services and products that can be covered in the deductible period, and issue guidance on the amount of funds that can be carried over at the remainder of the year for the FSA. So this one's a very big one, especially concerning individuals with high deductible health plans and health insurance, individuals that get offered health insurance through their job and that have an FSA, or maybe they have a small business and they have a flexible spending account. There were some limits before where you can only put so much money on an FSA, and you can only spend and then it wouldn't get carried over. They're trying to change some of those things. So what that's going to translate to is, it's going to translate to into more empowerment for the patient, or the the patient, because if they're allowed to roll over their funds, they don't have to spend them, they can accumulate more, and if anything comes up, when it does come up, then they can use those funds to, if they need a surgery, they go into the emergency room, whatever the case might be, they will use those funds, and if there's more, that's less that they have to grab from somewhere else to spend on healthcare. So that is a very, very wise thing to do, especially if the other things that are implemented work when it comes to the price transparency. Then you can at least know, I have this much, this is going to cost me this much, and it's definitely a step in the right direction. Now, the big thing here, however, is when it comes to healthcare, yes, it's the quality of healthcare. That's number one that I believe they're focusing on. They want to make sure that when a person goes to their doctor, the doctor's the one actually that is in front of the patient, making sure that they're listening to the patient. So when you are cutting the regulation, then that makes it easier for doctors to spend that time with the patient. So that's one of the big things. The other big thing is in reference to insurance, which this bill, there was a previous bill that covered that, and that's gonna hopefully cut back on some of the premiums that we have been experiencing. And if it does, if everything comes together as it should, then number one, we're gonna see a better outcome for patients, and doctors are going to be able to treat their patients. And number two, it's going to cut back on the cost as well as the premiums. Once you cut the cost down, the premiums are going to come down by default, because the insurance company is not paying as much, and the patient is not paying as much, or the patient can afford certain services, and instead of having to rely on the plan to pay 90%, they can rely on the plan to pay 20% and maybe get a cheaper plan, as opposed to getting the high-end plan, because they're concerned that they might have to pay a lot. So when you empower consumers with the information, then they can make a wiser choice, because they can say, well, why am I going to pay $300 more a month, which is like $3,000, $4,000 to $3,600 more a year, when it's only going to cost me this much if I go into have this type of surgery. I'd rather pay $300 less, take the chance, and maybe if I have a surgery, it's only going to cost me $1,500, and I'm still saving, I'm still coming up ahead. But those are just speculations at the moment, and I hope my analysis is correct, and I hope that we take a step in the right direction. Like I said, there's going to be many entities that are going to resist this, specifically the hospitals, because they're raking in the money right now, and so the more they keep us in the shadows, the less we as consumers can take back some of that power. But if you have multiple hospitals, they're all competing against each other, they're going to make sure that they, number one, do their best, number two, charge a reasonable price, not try to price gouge you, because right now you go in, you don't know what you're going to pay, you just get a bill. It's frankly, it's ludicrous. The only thing that I see that still is going to be an issue is, obviously, if you go into an emergency situation, you can't really check the prices beforehand. You're just going to go in and boom, that's it. So but at least, again, step in the right direction, and hopefully everything works out the way it should. Anyways, thank you for watching. Feel free to leave any comments if you have questions, and I should be getting doing more videos on, as things develop, giving you my analysis on these topics regarding healthcare. Anyways, thank you for watching.